So is Seroquel or Quetiapine the most versatile antipsychotic? Well, in my opinion, yes, I think it is. And in this video, you're going to learn everything that you need to know about Seroquel or Quetiapine. So stay tuned. So number one, what is Seroquel or Quetiapine? So Seroquel or Quetiapine is an atypical antipsychotic or mood stabilizer. It blocks the D2 receptors, which helps to reduce the psychosis in schizophrenia and bipolar disorders. It also blocks serotonin 2A receptors, which enhances dopamine in the central brain regions, which helps to reduce motor side effects that were very common with the typical antipsychotics. And this action can possibly also increase cognitive affective symptoms in psychosis. Now, Seroquel or Quetiapine has many other interactions, and this is primarily due to its active metabolite, norquetiapine. So with this, you have the 5-HT1A partial agonism, which may also improve those cognitive and affective symptoms. You also have norepinephrine reuptake blockade, which helps with the antidepressant effects and boosting mood. The 5-HT2C and 5-HT7 antagonist actions, which also contribute to its antidepressant effects. So Seroquel or Quetiapine has many complex binding sites, and it's very dose dependent. So when you're looking at 300 to 800 milligrams, and 800 milligrams being the max dose of Seroquel or Quetiapine, that's where you have the broadest range of the binding sites in all of these different areas being active in this molecule and in this medication. When you get to the 300 milligram dose, you'll see more of the antidepressant effects at this dose, and you'll see here all the different binding sites. So you have the norepinephrine transport system, the 5-HT1A partial agonism, 5-HT2A, 5-HT2C, 5-HT27, and the alpha antagonism. And again, all of this combined really gives it its action for the antidepressant effects. And then when you get into very low doses like 50 milligrams and below, that's where you have the sedative dosing or the hypnotic effects of Quetiapine or Seroquel, and this is primarily due to the H1 antagonism, and that's where that binding site is most active and the others are not. So you're not going to get much antidepressant or psychosis or antipsychotic effects from the 50 milligrams or below because only the H1 antagonism is actually being bound. So what is Seroquel or Quetiapine used for with all those different binding sites and all those different attachment and all those effects on all those different transport systems? What is it used for? Well, this is where it becomes very versatile. And so you'll see Quetiapine or Seroquel was actually FDA approved in 1997. And it's FDA approved for acute schizophrenia, acute mania and bipolar maintenance, bipolar depression, and as a depression adjunct when using the Seroquel extended release formulation, and also schizophrenia maintenance using the Seroquel extended release formulation. Now, there are many off-label uses which make this very versatile. So it's used off-label for other psychotic disorders, mixed mania, behavioral disturbances in dementia, particularly with Parkinson's or Lewy bodies dementia, psychosis in Parkinson's treatment, behavioral disturbances in children, disorders with impulse control, treatment-resistant anxiety, and it's also used as an alternative to benzodiazepines for the treatment of anxiety, post-traumatic stress disorder, and insomnia. So how long does it take to work? Well, if you're treating psychotic symptoms seen in schizophrenia and bipolar, it's going to work within 1 week. However, if you're looking to target depression or those cognitive and affect symptoms, it's going to take up to 6 weeks, and in some patients even 8 weeks to determine its full efficacy and to determine if it's going to work for those symptoms. Now, some patients will need 16 to 20 weeks to really have a good response to those negative affective symptoms or cognitive symptoms that are often seen in schizophrenia. And you want to make sure you're on a therapeutic dose when determining whether or not this is working. So a therapeutic dose would be anywhere from 300 to 800 milligrams when you're treating psychosis and bipolar disorder, and with depression, 150 milligrams to 300 milligrams. So, is Seroquel addicting? Well, no, it is not addicting. But if you saw my video on antidepressants and addiction, you'll know that neuroadaptation can occur. And though this isn't an antidepressant, neuroadaptation can still occur with all of the effects that are going on with these different neurotransport systems. So, if you're taking Seroquel or Quetiapine for longer than 3 months, you want to make sure that you decrease it very, very slowly, or you could be at risk for rebound psychosis or some withdrawal symptoms. Also keep in mind that it does have a relative short half-life of 6 to 7 hours. And the other thing that I want to mention here is that Seroquel has been shown to have some abuse potential and reports of patients abusing it. But don't confuse this with addiction, because anything can be abused, such as ibuprofen. People will abuse that, or Robitussin DM, mixing that in with soda and things like that. Kids do that all the time, right? Doesn't mean that Robitussin is addicting. Well, there have been reports of Seroquel being abused because of those hypnotic properties that it possesses. And so I will be making another video in the future about Seroquel and its abuse potential and all of the different factors involved, because that is actually very dangerous. It not only creates a stigma around the use of Seroquel, but it's also very dangerous when you combine Seroquel with alcohol or other drugs. Now, moving on to side effects. So commonly what you're going to see with Quetiapine or Seroquel is sedation, dizziness, dry mouth, constipation, elevated liver enzymes, indigestion, and weight gain. And weight gain can be very problematic. And this is part of what's called metabolic syndrome. And so metabolic syndrome is another effect that can happen with Seroquel. And this is where you'll have, along with weight gain, high lipid, high cholesterol, and high blood sugars. And this can actually predispose you to diabetes. And up to 23% of patients who take Seroquel will actually have a greater than 7% of their body weight increase. And this can be problematic. Also, another study showed that after 26 weeks of treatment with Seroquel, the mean increased body weight was 4.4 kilograms, which is about 9.7 pounds. So after 6 months of taking Seroquel, this group of patients actually gained about 10 pounds. Another side effect to be aware of is hyperprolactinemia, and this is elevated prolactin levels, which doesn't happen very commonly in adults, but with children and adolescents, it can occur in about up to 13.4%. And what elevated prolactin levels can do is that it may inhibit reproductive function in both males and females. It can also cause galactorrhea, which is the expression of breast milk, and this can happen in both male and females. It can also cause an absence of a menstrual period, gynecomastia, which is breast development in males, and impotence. So it's always good to make sure you're getting your blood levels checked, not only because of the metabolic syndrome, but also getting the prolactin checked to see if you're having any issues with elevated prolactin. Now, some rare and dangerous side effects that you need to be aware of with Quetiapine or Seroquel include, of course, the black box warning. And there are 2 black box warnings with Seroquel. Number 1 is the suicidal ideation because of its antidepressant effects. So that's seen typically in 24 years of age and younger. And the black box warning for the elderly patients, and specifically elderly patients who have dementia. It has been shown to actually increase mortality in that population because it increases their risk for stroke. Another rare but dangerous side effect to be aware of with antipsychotics in general is neuroleptic malignant syndrome, or NMS. And this can include hyperpyrexia, which is high fever, muscle rigidity, altered mental status, autonomic instability, so that's increasing heart rate, blood pressure, sweating or diaphoresis, and cardiac dysrhythmias can occur. And this is a medical emergency. So if you're experiencing any of the symptoms and you're taking Seroquel, go to the emergency room right away. Another rare but dangerous side effect with Seroquel is EPS, or the extrapyramidal symptoms. And this includes akathisia, which is the internal restlessness or agitation that you can experience with some of the antipsychotics. It happens with Seroquel, but this is dose dependent, where you see this happening more in the 400 to 800 milligram dosage ranges. Tardive dyskinesia can also occur, and those are the involuntary movements of the mouth, jaw, tongue, facial areas. Parkinsonisms, which is like the pill rolling movements or shuffling gait, and muscle dystonias or dystonias, which could be contractions of the muscles in the neck and shoulder. So providers should be checking you for any of these movement disorders anytime you go in and have a visit with them, because a lot of times they are involuntary and you may not notice them. However, with Seroquel or Quetiapine, this is a rare occurrence in the lower dosages and becomes more of a concern when you get into those higher dosages when you're treating psychosis. Another issue to be aware of that is rare with Seroquel are the blood dyscrasias. So leukopenia, neutropenia, and agranulocytosis can occur, and these are all abnormalities in your white blood cell counts. So make sure again that you're getting your blood levels checked. And seizures can also be a problem with Seroquel. It does decrease your seizure threshold, making you more vulnerable to seizures. So if you have a seizure disorder, you may not be able to take Seroquel. Hypothyroidism has been reported in some rare cases. And so again, a good idea to get those labs checked. And cataracts have also been shown to occur with Seroquel. So make sure you're also getting regular eye exams. Now, moving on to drug interactions with Seroquel. So Seroquel or Quetiapine is primarily metabolized by the CYP3A4. So you want to be on the lookout for inhibitors or inducers of that substrate. Also, you want to be cautious in using antihypertensive medications or blood pressure medications with Quetiapine, because it can actually decrease the blood pressure even further and cause orthostatic hypotension, and this is very common in elderly patients. It can also antagonize dopamine agonists like levodopa and block the effects of that medication, which is used in Parkinson's. And there have also been reports that Seroquel or Quetiapine can increase the INR, which is the bleeding time level, and that is often measured when patients are taking Coumadin, which is a blood thinner. So if you're on that and Seroquel, make sure you're getting your INRs monitored and checking that it's not affecting that bleeding time. So with Seroquel, you want to avoid the use of medications that can increase the QT interval, because that can lead to arrhythmias. And you also want to avoid the use of alcohol. As I mentioned earlier, Seroquel has been shown to be abused, and a lot of times it's being used with alcohol, and this is very dangerous. It increases the somnolence and sedative effect, which can lead to decreased respirations and even death. Furthermore, alcohol also decreases that seizure threshold. So if you're taking high doses of Seroquel and then drinking alcohol, you can actually go into seizures. And a lot of times when patients are abusing Seroquel and drinking alcohol, they end up in the emergency room. So my final thoughts on Seroquel or Quetiapine. Well, yes, Seroquel or Quetiapine is a very versatile antipsychotic or mood stabilizer. There's no doubt about it. It's a robust treatment for bipolar disorder and treats the spectrum of bipolar disorder, and is the only antipsychotic that has the FDA approval for the whole spectrum of bipolar disorder treatment with one singular pill. However, there's always a downside, right? And with Seroquel, that's the metabolic syndrome. And this is very common with Seroquel. No matter what dose that you start at, or no matter what dose that you end up on, you are going to be at risk for this metabolic syndrome, which is the weight gain, the high blood sugar, and the elevated lipids. And so you have to be very careful when taking this medication, making sure that you're checking your blood levels frequently, at least every 3 months for the first year, and then every 6 months after that. And even though this is a major problem with Seroquel, some patients are actually able to overcome this with a strict exercise and diet regimen. And so keep that in mind, that if you find that this medication is right for you and you're getting good benefit from it, that you may need the help of a physical trainer or even a nutritionist to help get you going with a good exercise and dietary plan that you can sustain as your new lifestyle. And that can help mitigate this metabolic syndrome. So there you have it. That is my overview on Seroquel or Quetiapine. Do you have experience taking this medication and you'd like to share it? If so, drop your experience down in the comment section below, because we learn from sharing each other's stories. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.